Welcome to Skin Sense. We're back here with Dr. Steven Schleicher, and I'm excited to be back here in the studio taping new shows with you.
It's been quite some time.
I
but
know.
I'm happy to be back too, because I kind of miss the audience.
How long have we been doing Skin Sense together?
I think since 1834.
Oh my God. We have to do a blooper show though.
My hair wasn't that gray back then, but what can you do? Thank goodness for hair dye.
My hair will never be gray. Blonde forever.
Okay, well, whatever.
Well, a lot has changed, right? A lot has changed. You're back to Derm Docs.
That is correct. I was with Reading Dermatology Associates for many years, and they got kind of too big, okay, in Reading, and they said, take your practice back.
Yeah.
So I did. So
and it's
about
awesome
a month
for your
ago,
patients.
Yeah, about a month ago, I took my practice back, and I'm now kind of running the practice, which I haven't done. Yeah, kind of. You know, I'm pretty,
it runs itself.
Yeah, it kind of runs itself, and if it doesn't, it doesn't. But I'm still here, and of course, I'm still at the same office, and we have the same phone number, and we have the same women working for us. And we have, well, we'll introduce our fellow shortly, okay, in another segment. And we're maybe hiring a PA.
All right.
So, you know, we have some changes, but right now everything is like it used to be.
Okay, so the only thing that changed was the name is now back to Derm Docs. You're still located on Laurel Street in Hazleton, Pennsylvania. So if you see the name change, that's the only thing that's different. Dr. Schleicher's still there, his staff is still there, all that good
For some reason, the phone numbers are the same, but people never really associated me with Reading anyway, because, you know, who thinks about, you know, Hazleton and Reading didn't really mix. So now, hopefully, people will be able to associate me more with the local office, which will be good.
And people definitely associate you with your experience and your background, so just to give us a refresher on that.
Right. Well, you know, I am a board-certified dermatologist. I do a lot of teaching. I'm on staff of 2 medical schools. We take PA students on rotation. We take nurse practitioner students on rotation. And I've been actually in Hazleton since the 1980s. So I really enjoy it here. And actually, I really enjoy the downtown. Okay, I know there's a lot going on downtown. And I went through a stage where, as you know, Hazleton was kind of dying.
Right.
And now it's revitalized. And,
Yes.
you know, I'm happy to be part of it, and I really like it here. You know, I could.
And you've traveled the world. You've written many different books.
Yeah, I mean, I've lectured, you know, throughout Europe and in Brazil, and so I've been quite a few places. Probably practice anywhere. Everything's great about Hazleton except maybe 2.5 months of the winter. And then
Well, this year we're gonna skip over winter.
We'll skip over winter, and maybe if I'm lucky, if I hit the Powerball, I'll spend 2 months in Miami, and I'll be real happy. Except then you got to worry about Zika, so you can't win.
No Zika
right?
here.
So I don't know where I'll go, but I'll probably be here. Like I'm always here.
All right, well, we're going to do new shows for you now that you're under your name and it's your business, the Derm Docs. Today, our focus is going to be on podiatry and how podiatry relates to dermatology, correct?
Exactly, yes, because I have the only joint podiatry dermatology fellowship in the country, and we'll be introducing this year's fellow very shortly.
All right, so stay with us right here on SSP TV, brand new Skin Sense with Dr. Steven Schleicher. And welcome back. You're watching Skin Sense, seen on SSP TV throughout northeastern Pennsylvania. Dr. Schleicher is with us. And again, if you missed us in the beginning of the show, we're back to Derm Docs. Dr. Steven Schleicher is now back to being the owner. So nothing's changed at the office other than we're back to the former name of Derm Docs, right?
Kind of the former name. It's almost, there's a little O in there, but it's really close.
It's really close.
Yeah, it's really close.
And we have our guest with us today, and that's Michael Stas. So thanks again for being with us and sharing time here. I don't know how you're going to be able to put up with Dr. Schleicher for an entire year, but that's a whole nother story. We'll talk about it at another time. So thanks for being here.
Well, thank you for having me.
So podiatry, you're here learning, as doctor said, your practice is the only practice that has the joint podiatry and dermatology center.
Fellowship. It's actually a fellowship. It's a 1-year fellowship. And,
Okay.
it's the only fellowship actually in the world that combines the two. And it's done in conjunction with St. Luke's Hospital Systems down in Allentown and Bethlehem.
Why is that important to the patients?
Well, it's important because there's a crossover between skin and obviously feet. And in our third segment, we'll actually talk about some of the conditions which are in common to both. So, and it's just like you take family medicine, okay? A lot of family practitioners just haven't received training in dermatology, but the majority of people who have skin problems actually go see their family doctor. So, similar to podiatry, a lot of conditions relate to the skin of the feet, and if you haven't had training in skin problems, well, you know, you may misdiagnosis or not know what you're dealing with. So it's very, very important, and I've trained now probably some 10 fellows. The first fellow I've trained, I've actually co-written a book with her, and she is now a professor at Temple. So, yeah, all my trainees have done very, very well, and they're all very valued because, you know, they're it. I mean, there's been 10 trained in the whole country, and that's it. That's it.
All right, so tell us your background.
Well, I was a personal trainer for many years. I went back to school when I was 33 to get my degree in exercise science, and I ended up getting a C on a chemistry exam, and it kind of motivated me to maybe push myself a little bit harder. I switched my major to pre-med, which is natural science at the University of Pittsburgh, and kind of plugged through it a couple classes at a time. I had to work for a living, obviously, and just graduated my residency in 2013. Decided to do a fellowship in dermatology because we didn't get a whole lot of dermatology in our residency. It was mostly surgically based, and we see an awful lot of dermatology. So I thought that it would be very useful to have this background, to have this experience. I came up and interviewed with Dr. Schleicher. He's a great guy. I thought it was a great match, and I'm happy to be here. I'm having a good time.
How long have you been there so far in his
I
office?
started these fellowships as the residency programs. They run from July through June 30th.
Okay.
Hey, I've already taken him to the Mohegan.
All right.
I've been there.
So you're set. You're showing him around.
And he loves hiking in the outdoors. So.
Oh, you'll love it here.
Yeah, well, no,
hiking.
he's big on that. So you were where? Just in Jim Thorpe? Or?
I was at the Appalachian Trail. I've been to Nescapec State Park. I went to Glenanoco. I told Dr. Schleicher yesterday, for anyone that's new to the area, my advice would be get yourself a good pair of hiking shoes because you got to get out there and see the area. It's just beautiful.
All right. So the correlation between podiatry and dermatology in your office, what have you seen?
Well, I mean, related to the feet, we've seen things like warts, of course, like athlete's foot, which is really a fungus. You don't have to be an athlete to get athlete's foot. Things like eczema, things like contact dermatitis, okay? These are very, very common entities. And, you know, we all, put our shoes and socks on every day, so that means we all look at our feet every day. And people can get moles on their feet, okay? Bob Marley, the famous reggae singer, actually died from a mole under one of his toenails. So, you can get skin cancer that affect the feet also. So there are many things. And then if you go higher up, when you get to the ankles, you see things like varicose veins, which, they're very common, and to some people, they're horrendous. So, there are treatments that you can do for varicosities. And then we see problems related to circulation, like ulcers, okay? And if anybody knows older people who have poor circulation, skin can break down, and when it breaks down, you get an ulcer. And ulcers can be very, very serious, and ulcers cost this country, literally billions of dollars every year in their care, because if you don't care for them, you can actually lose a foot, lose part of your leg. So, we advise everybody to keep, especially if you're diabetic, to check your feet and ankles regularly.
All right, when you say check your feet regularly, what are some of the items that people really let go and have you see them at a later time where they should have
Mike, from
received treatment earlier?
Ulcers, well, you could talk a little bit about ulcers and diabetes. And
we work with a lot of diabetics, and one of the common conditions that diabetic gets is they lose the sensation in their feet. It's called peripheral neuropathy. So they can't really feel if they have anything going on the bottom of the feet. Some of them have a lot of different morbidities, obesity, don't ambulate very well. So when they come in to see us, we see things that they normally wouldn't see. Okay. And a lot of times ulcers and wounds on the bottom of the foot, they get neglected because they can't feel it. There was actually an article written on this. Because they can't feel their feet, it's almost as if it's not their foot. So when we see someone come in with a bone exposed and necrotic dead skin, the first thing you think to yourself is, well, how could you let this get this bad? But the truth of the matter is they don't feel it. They have no idea what's going on. And these are some of the worst case scenarios that we see, and we see it a lot. It's a lot more common than I would have expected to be coming into my residency.
Is that common with people who might be going through chemotherapy?
Ulcerations, we've seen a few, but mostly we deal with diabetic patients.
Okay.
Yeah,
I know sometimes you get
I can
that.
talk from personal experience because my father, and I lived several hours away, was diabetic and ended up cutting himself on the bottom of his foot in a shower. I had no idea. I don't know if he even knew he cut himself. But to make a long story short, he ended up getting gangrene in that area and lost his foot. And then, yeah. So
So it's that serious, so check your feet.
Right. By the
especially
time
if
I
you're
saw
diabetic.
it, it was too late to really even save the foot. So yeah, it happens, and it happens very, very frequently. So yeah, if you're diabetic, yes, you really want to see a dermatologist, podiatrist, perhaps even a vascular specialist, because diabetes affects so many millions of Americans, and it can lead to very serious problems if you neglect it.
And you talked about the varicose veins. What should people look for that they should be actually coming to see you?
Well, the veins themselves are harmless. It's just that over time, your vessels become sluggish, and the vessels are what really feeds the skin.
Okay.
So if your vessels are getting occluded, or if they're not moving, the blood is not flowing the way it should, then your skin isn't getting nourishment, and then even slight trauma can cause breakdown, and that's what leads to these ulcerations. And ulcerations are a major problem, and they're very, very difficult to heal many times.
So specifically, if you're a diabetic, you want to make sure that you're checking your feet a couple times a day to make sure that you do not have any cuts on them. If you do have a cut, you need to be seen.
Absolutely, absolutely. And even things like fungal infections of the toes. I mean, I'm sure everyone's here have seen people with these really thick toenails. Well, they're more common in diabetics, and if you have thicker toenails and you're diabetic, you're more prone to getting what's called cellulitis or superficial infections. So we do recommend diabetics see a podiatrist, once or probably twice a year, if nothing's wrong. If something's wrong, obviously you go sooner to your podiatrist or dermatologist.
All right. We're going to take a quick break. Again, we have a guest with us today, Michael Stas, and he is a podiatrist. He's here working on his fellowship, correct?
Correct.
With Dr. Stephen Schleicher, Derm Docs, here in Hazleton, Pennsylvania, on Laurel Street is where the office is located. You're watching Skin Sense here on SSP TV. When we come back, we're going to hit on some other issues, show you some photos, and educate you on podiatry right here on SSP TV. Welcome back to a brand new Skin Sense show here on SSP TV. We have Dr. Stephen Schleicher back with us, and our guest is Michael Stas. He is a podiatrist. He's here for 1 year, and 1 year only, right?
Correct.
Unless he flunks, then he has to repeat.
Yeah, well, I'm having a good time. Maybe I'll.
Maybe I'll purposely.
I didn't get it the first time. Let's try it again. Maybe I'll stay a
Right.
few years. I gotta figure out a way to win some money at the Mohegan.
I think if you know that secret, everyone's
Right.
waiting to hear that
If
over
anybody has any
talking
pointers,
about feet.
please see Michael here, okay? Because those penny slots just aren't making it.
Wiping me out.
So,
All right. Well, we're talking about taking care of your feet, especially if you're a diabetic, checking your feet to make sure if you have any cuts on there that you need to be seen. Don't let anything that is different about your feet go. You need to call and have it checked out. It could lead to some, as you said, serious
right.
conditions.
And those are serious conditions. And there's some conditions that really aren't that serious, but that are nuisances. We've all heard of warts, okay? And people can get warts on the bottom of their feet.
How do you get warts?
Well, it's caused by a virus.
Okay.
Okay, so it's actually contagious. So warts on the feet, if you have a wart on your foot and then you go in the swimming pool, lockers or whatever, and that, since it's caused by a virus, you can leave little traces of the virus on the floor. Somebody else will walk by and then pick up plantar warts. So, a lot of people are immune to them and they never get them. Okay, but the people who get them, they can be a real pain in the foot.
So if you're listening and your children have, swimming in school, or if your children are going to be in those areas where there's moisture, they should be wearing flip-flops.
Yeah, well, I mean, really, I guess the best thing to do is when you're home or whatever, to really take an antibacterial soap and just wash your feet.
Okay.
Because especially if you're exposed to it, or especially if you have other family members who have warts, well, that's going to be around the house. So, and like I said, warts on the feet are tough because they get on the bottom of your feet, and then the more pressure, you keep putting pressure on, so the wart's actually going deeper into the skin.
Oh, okay.
So the question is, how do you treat them once you get them?
And
that's why I'm holding this can
here. He has
here.
some kind of concoction.
But I'd really like to demonstrate this on your nose.
Of course.
Okay.
Always.
Well, right, always. Right? She's our guinea pig. But no, warts are kind of easy to treat. It's just that you don't want to cut them out like on the bottom of the feet because you can get scar tissue. And since it's a virus, you don't even know where the wart's living because you can't see it. So you may cut out the wart that's there, but it may be living somewhere in the border, and it's going to grow back. But by and large, the easiest way to treat warts, we use something called liquid nitrogen.
And this doesn't hurt. You don't have to numb
well, it's
anything?
Cold. It's just cold. It's like putting ice. So say this was a wart, we just treat it with this, and that's it. But if it's really thick, then either myself or Michael, we would actually pare the wart down. Okay, so Michael, maybe you could even talk a little bit more.
Yeah, on the feet, when you get warts on the bottom of your feet, they could be a little more stubborn because the skin's a little thicker. And a lot of times by paring it down and exposing some of the softer skin, the cryotherapy will work a little better. And we do that a lot. Warts for podiatry is what we would consider a bread and butter procedure because we see it so frequently. And it could be painful on the bottom of the feet, especially when it's in pressure areas. So paring down is something that we do as just part of a routine treatment along with the cryotherapy.
Now, do you only use that on the feet?
No, you can use this anywhere.
Okay, so if you have a wart, it should be removed.
Yeah, and we see, well, I mean, if warts aren't, the only time they're really serious are so-called genital warts, okay, because there are different strains of the wart virus. Okay. There's like 50 of them. However, the strains that people get that are sexually transmitted, several of those can actually cause cancer.
Okay.
Okay, so those we kind of have to be real careful about, and you have to, advise people that they have a sexually transmitted disease, and that, to warn your partners, have your partners checked because they can cause cancer, and that's, a well-known fact, and we've known that for now decades.
And that's a good point to make, especially looking at children. They might not know if there's something changing on their body. So if you're a parent or a guardian of a child, make sure you tell your children to
and again,
look
that's
for...
not the common word, so-called common
well,
word.
Well, not for that, but I mean for any changes on their body.
You bring up a very good point for children because we can now vaccinate children against the wart virus.
Okay.
And that is highly, highly recommended. Every child should be vaccinated because you're going to be preventing your child from possibly developing cancer years down the road. So yeah, by all means, vaccinate your child against the so-called HPV, okay, the virus that causes warts.
Okay, from warts to athlete's feet, what's the difference, because they are kind of related?
Well, no, I mean, you don't have to be an athlete to get athlete's foot.
Okay.
Athlete's foot is actually a fungal infection. Okay, and Michael, maybe you can even talk about, fungal infections of the feet.
Yeah, fungal infections are another common thing we see as podiatrists. And there's probably a genetic predisposition to this. The people who get it seem to get it frequently, and it seems to recur a lot throughout their lives. People who don't get it just don't seem to get it. So there's a myth about going into the shower without flip-flops. And yes, that will definitely contribute and make you prone to the virus if you are prone to the virus. But if you're not, chances are it's not going to happen. You're not going to get the virus. And like Dr. Schleicher said, you don't necessarily have to be an athlete. I would say 95% of the people we see with fungal foot infections are not athletes. They're typical workers in offices and school teachers and construction workers. And it's, like I said, very common. We can treat it with an oral medication, or we can treat it with a prescription antifungal medicine. Sometimes we'll prescribed something called Lotrazone, which is actually an antifungal medicine with a corticosteroid in it, and that seems to do very well. But again, it's a very common problem.
And the good thing is it's very easy to treat. And actually, most cases of so-called athlete's foot will respond to over-the-counter medicines like Lotramin, like Mycotin, like Lamisil. So you can, in essence, save yourself a trip to the doctor, and if it works, great. If it doesn't, well, it may not even be athlete's foot, it may be something else. But one of the things we should talk about too, many of our viewers out there have probably looked at toenails that look gross. Okay, they're thick, they're dark, and that's most of the time a fungal infection affecting not so much the skin, but actually the nail. Okay, and it's more common in elderly patients, and that's very difficult to get rid of. Okay, you really do need oral medications, and you've all seen the commercials for Jublia, okay, and that's a topical. The problem is the topicals just don't work real well for nail infections, and by and large they're very, very expensive. Whereas the pills, you can take pills for toenail infections, and the pills are like $5 for a 10 or 2 week supply, as opposed to $1,000 for a month's supply. And with the cost of healthcare these days, things are getting a little out of hand.
And I think that's why people don't get checked anymore, because they're afraid of what that expense is going to be. Eczema. What's the difference with getting eczema on your foot as opposed to getting dry skin? Like, how do you tell the difference?
Well, actually, eczema is a form of dry skin. Okay. Eczema starts by your skin becomes itchy. We call it the itch that rashes. Okay. Eczema is very common. Some 2-3% of the population has eczema to some degree. It's very common in kids. A lot of adults will grow out of it. But what does it look like? Well, it looks like just what you said. It looks like dry skin. But over time, since it's itchy, you start scratching it. And then it becomes red. And then you develop scratch marks. And then over time, your skin becomes thicker and thicker and thicker.
Now, how do you get this on your feet?
Well, eczema can happen anywhere. Okay, yeah, it can happen anywhere. It can happen on your face, it can happen on your arms, it can happen on your feet. And we see people who have it all over their body. So you never know where you're going. If you're prone to it, it's a genetic predisposition. You never know where you're going to get eczema. But by and large, too, it's fairly easy to treat, but there's no, unlike athlete's foot, which you can cure, there's no real cure for eczema, but people tend to grow out of it, and we can control it so that you're obviously a much happier person if you're not scratching all the time.
Okay, we have about 1 minute left, but Michael, if you could touch on, you can actually be allergic to your shoes. Is that correct?
That is correct. That is correct. There are cases of people coming in with unknown, unidentified rashes. We think maybe it's athlete's foot, it could be eczema, and it turns out that they do have an allergy to a material that's in their shoe. And this isn't real common, and we don't see this a lot, but it does happen. In cases like that, as a podiatrist, generally we will send a patient to an allergist just to make sure there's nothing more going on. But it is something that we do see.
So you got to take care of your feet here. We're running out of time, but we want to thank you for being on. I'm sure you'll be on again before you leave.
Well, thank you for having me. I had fun.
The area.
Do a live shoot from the Mohegan.
How about it? They love it. And I'm sure my Mohegan friends are loving all these plugs they're getting on our show, too. But that's all the time we have. Doc, thank you. Again, Mike, we'll be in touch. I'm sure you'll be seeing us around here for the next couple of months. You'll be on our shows. We're going to tape more regularly now. Absolutely. Under the name Derm Docs.
Derm Docs, yes. Until I change it again.
The office and the people will be the same. We'll just keep changing the name.
Right.
All right. Well, thank you so much. And thank you to our viewers for tuning in to SSP TV. And you can join us again on ssptv.com, where you can see this show and any of our program here on SSP TV.